Shargul is 20. She has schizophrenia. Police found her roaming the streets collecting rubbish after her husband's family threw her out. But in Afghan terms, Shargul is lucky because she has a bed in Afghanistan's only psychiatric hospital. Before, she was mocked and ridiculed within her own community.
People were saying if she's mad, then the other women in the family must be too. They gossip about her. No one says a good word about her.
According to the World Health Organization, over 60% of Afghans suffer from mental health problems. Doctors here say they think the figure is much higher. Over in the men's wing, 50-year-old Abdul is waiting for treatment.
Okay, and before you came here, what was your job?
I was the headmaster of a school.
Abdul worked in teaching for 30 years, but the minute he developed psychiatric problems, his pay was stopped and he lost his job. Abdul has a wife and 5 children.
This mental health hospital is the only one in the whole of Afghanistan. There are just 100 beds to treat anyone with mental health issues in the whole country. And doctors are desperate for more funding, for medical equipment, for food, for beds and even clean bedding.
Lunch today was rice and potatoes. Basic health care across Afghanistan is scarce and provision for mental health is far from a priority. But decades of war have left scars on many Afghan minds.
Most
of these mental problems are because of war and instability. Our political and social problems add to this. Many people suffer from violent trauma and from depression. Afghan people have these kinds of problems more than most people.
Extreme poverty, conflict and abuse are just some of the reasons psychiatric problems are so high here. But the patients Afghanistan's solitary mental health hospital can treat are a tiny fraction of those desperate for help. Turton, Jazeera, Kabul.